Is the NHI the key to unlocking basic health care?
Within the South African context, we're actually spending an enormous amount of money on healthcare. But we could be doing a lot better in terms of health outcomes. We don't have very good health status given the amount of money that we're spending. Certainly, I don't think that the health system in South Africa should be about some South Africans being able to get whatever healthcare they desire and the rest of the population being provided with the bare minimum. For me, basic care in the South African context, we should interpret as every South African should be able to access the care that they need within the constraints of the package of care that can be afforded within the South African context. And my assessment is that that package is quite comprehensive given the resources that we do have. And I think there's been a lot of misunderstanding and a lot of confusion because the term national health insurance has been used. So a lot of people think it's just about money and that it's about the creation of some big insurance scheme, which is not how I understand it. It's not just about money. It's about transforming the health system. A key vision of the NHI proposals is to get an integrated pool of public funds, a large pool of public funds. And what do I mean by public funds? I mean funds that can be used for the benefit of all South Africans, not funds that are put aside just to be used for some people. There is scope for improving efficiency within the public sector. We could be delivering more services with the financial resources that we have, and we've got to address those efficiency problems. But ultimately, we actually need more money in that pool of public funds if we are going to meet the health needs of the majority of the population.
Firstly, the amount of money that government is ever going to get for public service is always going to be constrained by how much it can tax at a maximum within the system. The South African health system performs extremely badly. Now, Di mentioned performs extremely badly for the amount of money that South Africa spends. Actually, South Africa's public health system performs exceedingly badly for the amount of money that's spent in public health systems and on public health with equivalent amounts internationally. Why do we have such extensive fraud and corruption throughout the public health system? A number of important things, I think, that certainly concern me about the national health insurance debate. One of the issues is the usage of the term and the fact that it actually has no content at all. It is a completely substanceless term without substance. And I haven't seen a single recommendation in any of these NHI discussions that actually talks to that at all. These are very, very high-risk proposals. And in my view, they don't address substantively any of the real issues in our health system. And there's a big risk that, in fact, the agenda is really not about improving healthcare.
The work of the Black Sash is premised on the progressive realization of socioeconomic rights, making human rights real. And so our involvement in getting to understand what needs to happen in addition to the national health insurance, what are ordinary people feeling on the ground, what should happen for a system to change and serve people better. What set of values would underpin, what do people think is necessary in order to make human rights real, in particular health system reform, a reality that is accessible and universally accessible to everybody. I also need to say that the Auditor General of South Africa has recently published some reports which shows the disjuncture between an unqualified audit in the sense that money has been spent and accounted for, but it doesn't align with the developmental priorities of the municipality or the province per se. The quality of non-financial performance outputs of municipalities and provinces fall far short of the money that was spent. I mean, the Western Cape is one example. We can think of several examples where you have unqualified audits, but people are ill. Yes, there's huge scope for improving healthcare, but in order to do that, we've soon learned that in many provinces, there are many, many determinants that prevent people from having access to healthcare. When we asked people, based on information they learned, sources of funding, how they see a health system reform working and where should the money come from? There were the principles of the rich must subsidize the poor in the South African context, and the healthy should support the sick. They said there's a window of opportunity, and that window of opportunity must work. People have to see results. People have to see changes.
Over to you, to the public.
Some of these policies, sometimes like the NHI, are developed exclusively without the consultation of ordinary people.
We've heard from all three speakers that the real problem is that our healthcare system doesn't function properly. Are there any proposals or what needs to be done to actually sort out the problems that exist? Why doesn't it function?
At the Red Cross Hospital, as Elroy was saying, towards the last few years of my career, I spent many, many stressful hours finding beds for an increasing number of sick children, getting sick because essentially of inequality in this country. People live in places where they get sick. When they come to the health system, they have to sit in queues and wait for sometimes days to find beds. That's the current situation. We do need mass mobilization around health.
Whether to respond to the two questions or maybe just to add or conclude just before I just conclude.
Become involved in policy formulation. Do not wait for government. It's too precious an issue for us to be quiet about it.
There are many alternatives. These issues that I'm raising, although I'm raising them in a negative point, it's about coming to a diagnostic, an accurate diagnostic of what's going on so that you can actually solve the problem. Because if you don't actually say, why is the hospital not performing, then you don't get down to saying it's the governance structure, which nobody's come to. So the issue is that, in fact, in our system, what we do need to do is centralise the allocation of funds. I agree with that fully. I don't think we should have a national purchaser. I think we should have a national resource allocation process that's competent. And then I think at the provincial level, we should have diffused governance structures with proper governance and accountability in place, which includes civil society, which includes people from the local community who are involved in the oversight with real teeth to remove people who are appointed.
The challenge that we face within the South African context is that we have two pools of funding. One, and they're both about the same size. Tax money, medical scheme money. And I stress again, they are the same size. This is serving 16% of the population. This is one of the fundamental things about why we need to change the way in which health services are funded, is to actually deal with that inequity. I'm not saying wipe the private sector off the face of the earth, but we have got to find a way of actually having a better public-private mix where the resources are appropriate to the population that is being served.
We need to clarify for our understanding, because Alex has got a point, but what I'm not sure of, are you saying that are we too poor as a country to afford NHI, or are we too incompetent as a country to manage or even to start NHI, or we don't need NHI, let's fix the public health system?